everyone, sorry for the delay. This is Dr. Shweta Patel coming to you from Florida with Gaya Wellness, and today's topic is going to be breast cancer awareness and what's the real deal about it. So breast cancer is a very important cancer that can affect women, and the overall risk for that happening is 1 in 8 women in their lifetime will possibly experience having breast cancer. It is definitely a age-related risk in that the older we are, the risk increases, and the likelihood is, one time I thought this statistic was pretty interesting. I learned once that if you live long enough, you most likely will get breast cancer. Our lifespans don't currently support that, but I think that if we all lived up to 130 or 40 years, we would all have a higher risk. But with that being said, breast cancer is one of those cancers that the risk actually increases as we get older, as opposed to something like cervical cancer, where the risk actually decreases, and that's why cervical cancer screening at some point does stop. So with that being said, what are risk factors for breast cancer? Very similar to a lot of other cancers, our lifestyle has a huge impact on our risk. There's also the element of family history and genetics, as well as the potential that other mutations or genetic mutations or having other kinds of diseases can increase your risk. So to break that down a little bit, lifestyle. So just like most cancers that affect women, having a sedentary lifestyle or having a unhealthy body weight, in other words, being overweight, can significantly impact your risk for breast cancer. Smoking, having a diet that is unhealthy with exposure to lots of preservatives, having a high cholesterol, high fat diet in terms of unsaturated fats, not saturated, can also increase your risk. And it all comes down to, if you have an unhealthy diet or if you have a sedentary lifestyle, your overall reason for increasing the risk there is because you're more likely to be overweight or have more body fat. And the reason that can impact the increased risk for breast cancer is because the more body fat we have, in other words, adipose tissue, the actual fat pads that we don't care for, the more body fat that you have, that fat can actually increase the production of estrogen in our bodies. And it's part of the reason why obesity can affect men, in that it can actually reduce their testosterone levels. And it is a kind of reverse relationship with how that works. But predominantly, the simplest way to describe it is, if you are overweight, if you have excess fat on your body, you're increasing your risk for breast cancer because of the direct increase in exposure to estrogen your body has and your breast tissue has. So definitely want to make sure you're exercising, definitely want to make sure you're eating a healthy diet and making sure that you are not becoming overweight or your BMI is within range of healthy. Smoking definitely increases the risk for breast cancer, as well as many other things. And there are other risk factors as well. Alcohol intake can also increase your risk. Then there is the element of how often a woman has been exposed to her natural estrogen. So what does that mean? If you were very young when you started menstruating, or if it took you a very long time to get to menopause, that means your body overall was exposed to the average amount of estrogen for a longer period of time. So your overall estrogen exposure was higher than, say, someone who started menstruating when they were 15 and or someone who became menopausal in their 40s. So that is a risk factor. Things that actually reduce risk are pregnancy. And part of the reason being that when you are pregnant, you are not exposing your body to the same amount of estrogen as when you're not pregnant. And so women who have had multiple pregnancies or children, women who have breastfed, and again, that's because that's decreasing the the time that let me rephrase that. That's increasing the amount of time that your body is in that state of pregnancy where it's not ovulating, it's not menstruating, and it's not generating the exposure to estrogen like normal. So breastfeeding, having babies are all risk reducing factors, as well as being healthy and fit. And then family history, that's a big one and a very important one. Now, family history can be related to direct family history, as in if you have a family member that is a first degree relative, that carries an increased risk, or you can have multiple relatives who are not necessarily first degree, but the sheer fact that you have multiple relatives in one family can be an indicator that there is an increased risk for you as well. Having a male family member who has had breast cancer is a big red flag that we want to know about as physicians in your history. And then not all family history means genetics. So just because you have a family history does not necessarily mean you have a genetic mutation that predisposes you to breast cancer. Commonly misunderstood. It can, but it doesn't necessarily have to be the case. And I see that a lot of patients will get testing done for the mutation in the gene that is known as the BRCA gene, or the BRCA1 and 2 genes. And when they test negative, they feel reassured that they're not at an increased risk. And that's great. And you are correct in that you're not at an increased risk that comes with being positive for BRCA1 and 2. But it doesn't negate the fact that if you have like a first degree family member, or a mom, a sister, a daughter, or if you have a dad or a brother, or if you have an aunt, a grandmother, and a cousin. Those are all still risk factors that should be calculated or discussed with your doctor so that you can come up with a personalized plan as to what's best for you in terms of testing, screening, and taking action. And what can you do to stay on top of your breast health? So in general, the American Congress of OBGYN, which is our guru, we recommend having breast awareness. What does that mean? It's not like I'm not aware of my boobs all the time, but really just being able to have regular exams on yourself. And there's really no guideline as to how often you have to do it. There used to be one. We used to say once a month. Frankly speaking, if you're showering appropriately and scrubbing all the right places, you're probably hitting your breast exam metrics on a daily basis. But self-breast exams are usually the biggest tip-off and the most common reason why breast cancer gets detected. It's usually when the patient comes in concerned about a finding, as opposed to the once-a-year clinical breast exam that your doctor may do and find something on that. So definitely be breast aware. Grope your tatas, feel them out. Encourage your sisters, your wives, if there are any men watching or women. Encourage your female family members to be aware and to make sure that they're checking in on their girls so that we can, increase recognition and early detection. Other screening guidelines usually recommend anywhere from the age of 40 to 50 as to when you should start doing mammograms. Some women have started following an earlier time frame of 35. And again, this should be a discussion you have with your doctor as to whether you need to do that kind of screening earlier in your lifespan. And that would usually be something that is because of a family history or a risk factor that got detected, and you want to make sure that there isn't something already going on, or if you've had a exam and a finding on your exam and that led to early detection or early screening. Otherwise, most women are okay to start screening with mammograms at the age of 40, and I still recommend annually, especially as you get older, because again, going back to the risk factor of age, as we get older, our risk increases, and so we shouldn't be spreading out our screening as we get older. We should be doing it at least once a year. And the other thing that can be done, of course, is when you're coming in for your annual clinical breast exam, your doctor, if they find anything, then they may recommend having a mammogram or a breast ultrasound to further evaluate what the finding was. There's another thing that can be can confound findings on a breast exam or on radiologic imaging. The term dense breast is something I often get asked about. It's like, why are my breasts dense? Are they not smart? Just kidding. So dense breasts basically mean that they are not uniform and light in their texture. Think of fat as like a sponge or a foam. When you have normal breast tissue, it's just filled with fat, and it's light and fluffy and uniform, like a foam or a sponge. If you have dense breast tissue, that means that there are some lumps and bumps in there because there's some fibrous, or not necessarily scar-like, but thicker tissue that actually breaks up the uniformity of your breast, and it makes it actually heavier or more difficult to see through. If you were comparing density in liquids, it would be like comparing the density of apple juice and the density of chicken soup. You can see through one. The other, you can't actually see through. And that makes it very challenging when you have dense breasts to have that clinical screening done, because mammograms aren't always able to sufficiently rule out the possibility of a lesion or developing cancer when you have dense breast. Additionally, dense breasts can actually, within and of themselves, be an indication that there's an increased risk for cancer, because cancer usually starts in not just the fat tissue, but in the fibrous part of your breast. And so if you have a lot more fibrous tissue in your breast, then there is that increased risk as well. So if you have the terminology in your mammogram report, or if you are being examined and your physician mentions that, oh, you have dense breasts, nothing to worry about per se, but it definitely warrants follow-up after you have an imaging test done, because your mammogram may not sufficiently rule out your risk, and it may require you to have a follow-up ultrasound, a 3D mammogram, or even an MRI to make sure that everything is clear. So to kind of recap, breast cancer, 1 in 8 lifetime risk of developing it for all women. That risk does increase as we get older. So a woman in her 50s is more likely to develop breast cancer than that same woman in her 30s. Family history does increase your risk. So having a first degree relative, or having multiple non-first degree relatives, or having a male family relative are all red flags that we would want to know about. Having a mutation such as the BRCA1 or BRCA2 gene mutation definitely increases your risk and warrants a whole separate conversation. But if you are concerned that you may have this, or that mutation runs in the family, the quickest way to have that evaluated is speak to your doctor. They can order a blood test. It's very simple, and it can clarify any potential concerns. And then the way we normally would screen it is breast awareness, clinical breast exams at least once a year with your doctor, and starting at the age of 40 to 50, or perhaps sooner depending on your risk, we would recommend having mammograms done at least once every 1 to 2 years. My personal choice and recommendation for my patients is once a year, every year, starting at age 40 until about 75, unless something indicates otherwise. All right, guys, thank you for tuning in. And if you have any questions, feel free to just send me a direct message. Thank you for your support and following and sharing. And I loved all the comments I had about the Access Health interview that I was fortunate enough to be invited to do. And thank you for all your support in Gaya. Updates coming soon, some more. Our website's almost ready, and the telehealth platform is almost ready. So we're still shooting for May 15th. Hope you guys have a wonderful week. And